I know that I am sad. Voices in my head, I think that I've gone mad. Make them go away before my head explodes. Do you hear them too, or is it just a joke?
Well, that's a very good question, and I think implicit in your question is another question, and that is, can a person be a transsexual and not have had any surgery, and perhaps still not even dressing as a person of the opposite sex? I think the answer to what is a transsexual starts out with being it's a state of mind. And whether the state of mind and the wherewithal to have surgery is often dependent on someone's income, or whether a person has a sponsor or doesn't have a sponsor. And so we can't fault them for not having had the surgery just because they can't afford it. Now, as far as whether it's a state of mind, whether it's genetic, whether it's physical, there have been various studies done on brains of transsexuals, and one study finds that a portion of the thalamus, the hypothalamus, is different in transsexual patients. Another study critiques that, saying anyone on estrogens will have reduction of certain brain tissue in that area, and that's a hormonal effect. It's not a natal effect. In my opinion, as we look at people, for example, of either sex, we see a continuum in the way they appear. For example, if we're talking about the male sex, we see people that are very macho, that have what might say lantern jaws, and we see men that are very effeminate. And the same for women. We see women that come across as being very masculine in their gait and their appearance, and even in their interest. They like to do things that men normally would do. And we see other people that are extremely effeminate, very delicate. We look at bone structure. We see men with thick, heavy bones and broad feet, and we see men with the more delicate hands and narrower feet. So there's a continuum. Now, I can't say to you that just because someone looks more effeminate that they really have a desire to be that way. But if we can couple a desire to have transgender surgery with a phenotype, that means an appearance of someone who is feminine, certainly that seems to hold together. We feel comfortable as a surgeon doing surgery on a patient like that.
Ramblings in my head, I know that I am sad. Voices in my head, I think that I've gone mad. Make them go away before my head explodes.